Hello, everyone, and welcome to another episode of Why People Do What They Do, where we speak to talented and accomplished individuals from various fields. Today, we have Miss Sarah with us, who's a clinical psychologist and is going to talk us through why she chose her career path and how people can cope during these difficult times that we are enduring. Thank you, Miss Sarah, for agreeing to do this interview with us, this conversation. I'm so glad to have you on. How are you in Wellington, New Zealand? This is our second FB Live session, so thank you for doing this all the way from New Zealand.
No, thank you for having me on the show, Jacqueline. I'm doing well, coping relatively well. So it's nice to see you and nice to see everyone in Malaysia. Hi, everyone. Everywhere else.
Miss Sarah, tell us, I'd like to start our conversations with our guests with a little bit about what sparked their interest in their chosen career path. Tell us about your journey, how you got started in clinical psychology. What sparked the interest for you?
Okay, so I was a kid who liked to observe people and their body languages.
Ooh.
I think that's and as a teen as well, I was one of those that friends gravitated for some advice. Quite natural that was happening. And also I was I was interested in clubs like counseling, social clubs. Maybe that's telling at that stage as well. But that was the natural interest. But I think what sparked and obviously psychology wasn't an obvious career path. So I navigated towards hospitality management and human resources in the initial part.
I didn't know
and then
that.
And then realized that that's not my cup of tea, and I explored further and got into my bachelor's in human resources in UPM.
And what is it about the mind that interests you the most?
I think the simple answer is everything, but the immediate response would be how it kind of copes and how the mind accommodates and changes in every individual, and it's different, and how it accommodates and adapts in different circumstances, and such as now.
You mentioned that you did your bachelor's in human resources in UPM. So how did it evolve after that?
Bachelor's in human development.
In human development, right. And this is something that I'm really curious about, Miss Sarah. For psychologists, for psychiatrists, how do you cope with protecting your own mental health when you're seeing your patients, when they're just unloading so much onto you? How do you strike that balance between, I know you're a very empathetic person, how do you strike that balance between having empathy but also having that sort of objectivity that you need, so important when you're counseling your patients?
That's true. I think we'll start with proper clinical training, where you are trained as a clinical psychologist is very important. And it's true that when patients do offload, and sometimes it does get to you. So what you do often is do clinical supervision, and that's via your senior colleague, who will be giving you the support, so you can then go back and counsel or do intervention with the patient that we're talking about. But to strike a balance between having empathy and maintaining objectivity is, again, want to reiterate the fact that it's so important. Clinical training is so important. Empathy is a tool and is also a human skill, right?
Yeah.
So what you need to be able to do is use it wisely, so you can get the best out of the conversation that you have it. And it's also aptly as well, so in time, and not to condescend or anything in the matter, but just to be supportive, so you get that disclosure that you want, and you maintain a very good therapeutic alliance.
And I'm sure you also need that strength of character to be there for your patients, but also have that sort of objectivity and detachment as well, right?
Oh, again, that's why clinical training is very important, because we do go through quite an extensive training as an intern, as a clinical psychology student, that we do get exposed to scenarios like this in different work aspects. Like, you probably work in a child and adult facility. You could also work in a forensic setting. It depends where your internship is, because you'll be using empathy. You'll be using other skills that come along with clinical psychology and training in clinical psychology.
What is the most satisfying aspect of the job for you? What do you enjoy most?
I think that's easy. Is when the patient shows progress, and there is a reduction of symptoms and distress level. I think that's quite. I think that's quite common among all clinical psychologists, but particularly for me, yeah, that's most satisfying.
Miss Sarah, anxiety, depression, other mental health conditions within different spectrums, other areas of mental health are considered taboo subjects, even more so when you started in this field years back. People only started becoming more comfortable talking about these topics only recently, only a few years back, and more so right now during these difficult times. People who have not spoken about mental health before, now they are more open to discussing what they're feeling, what they're thinking, what they're going through. How did you get people to open up about subjects that are not necessarily the easiest to talk about back then when you started, and how did you progress along the journey?
I think seeking help in matters of the mind has always been difficult. It sometimes still is. I think that's important. But I think part of the game is having increased awareness. More people are viewing mental health as a component, as a very important component of general well-being, overall well-being, with children, and within self. In most, even with the older people, they tend to be more open as of now. But mostly, even back then, when patients often come to the clinic, they're always referred by a GP or a doctor, or a psychiatrist. So they do understand why they're there to seek treatment or intervention. But what they don't, they're not convinced with is if talk therapy will help. So
Right.
I think, it's very important for me. My role is to observe, interview, and do clinical psychological assessments and diagnose if there's any existing or potential disorders that are there. And the second thing I do with them is I explain to them their behaviors probably and their thinking process may have exacerbated the symptoms that the psychiatrists or the doctors have seen. So then we, gradually formulate a program or plan, or a sort of like a comfortable plan for between the clinician and the patient, so that we then, and also sometimes we need to adjust it according to where they are, and we monitor them. So along those through 3-4 processes, then you would see the patient's view of why they're there changes, and you get a little bit more compliance. But it is easier right now because there are a lot more awareness since back then, and it's not uncommon to seek psychological help when needed. It's more advisable. People talk about, have you seen someone? Have you talked to someone? Or they consider maybe even a counselor on the phone, or something like that, better than nothing. So I think that's paving the way to more people being open to get interventions and seek the services.
Why do you think people are more open now these days to talk about these issues? And do you think now, are you satisfied or are you happy to see society now on track to destigmatizing topics of mental health conditions? Do you think that's the case? Is it on track?
I think there has been, no doubt there has been positive shift in the importance of mental health awareness overall. However, there's always more that can be done. I think creating more positions for clinical psychologists in general hospitals, so people can get free of charge services, in the sense that they only pay, they're not paying too much out of their pocket, so it's the services are available and needed. And I do think I would even suggest a step further, like every department in the general hospital should have a clinical psychologist, because we can see our role being useful in all those areas, in the pediatrics, just not psychiatry. So it normalizes, I guess, seeing a clinical psychologist talking about something, even in surgery, emergency medicine, after the issue is something has happened, someone or maybe even their family members, they may need more support to talk through grief or loss, or going through anxiety. All these are very relevant in every department. If I like to see more clinical psychologists being offered a position in those departments. That's one. I think governmental funding for students who are doing clinical psychology has, of course, not paying out their own pocket, but giving them funding to do more programs where apt. That would mean more clinical psychologists, but more well-trained clinical psychologists because the funding is available. That makes it a little bit better. And on top of that, incorporating mental health topics with children in schools, that's something else that we can talk about. Most of them are already to some extent, but specifically maybe having clinical psychologists come to the school, talking about how it's not a stigma, how it's important to take care of it because it's a main component of one of the components of well-being, and reduce stress. That could be part of it. And most importantly is, I've had a lot of people coming in and saying that they are paying out of their own pockets again. So EAP services in factories or workplaces could again enhance the availability and also accessibility to people accessing these services.
I like what you said about getting kids to be aware and having that conversation with them from young. What do you think is a comfortable age for us to expose the topic of mental health with kids?
I think as soon as a child is able to articulate when a child is feeling, not even just that. I mean, most children can articulate by the time they are 3 years old, and some children have speech delay and everything. So what I think is important is to observe body language, observe if he's stressed, if this child is probably having anxiety or bedwetting or not talking about it. Anytime is a good time, really. Yeah. It really depends on the child, but it's also important if the parents are able to handle those questions and answers. Maybe that would be another avenue, is having clinical psychologists talk to parents about how to overcome their children's anxiety, especially in times like this.
And we've spoken about this before, and I know I've asked you this. Mental health condition is not like a broken leg. It's not something that you know when exactly it will get better, or when it does get better. There's no specific way for you to measure because you can't really see the wound. You can't really see when the wound is being healed. Only the person going through it can really understand the effects of living with a mental health condition. Can people be healed completely from a mental health condition like anxiety and depression? And how do we know the right method to get better? And when do we know when we have gotten better? Sorry, it's a three-pronged question.
I'll try to answer them all. But it's true. You're right to notice the intricacies of the mental health conditions. They're very intertwined, and it's a bit difficult to do that. But every individual and specific individual is different, so everyone heals or responds to treatments differently and at different times. I think what we need to understand is shift focus from total cessation of symptoms or total recovery, but probably focus on symptom relief, less of generally less of am I getting less anxious throughout this 3 months or within the intervention or post-intervention. The general indication would be when one notices that they're not too anxious, or their moods are not dipping as fast, or they're not too preoccupied, and it doesn't get in the way of their daily work or their daily social functioning. Because and the DSM-5, and it explains that when someone is considered to have a disorder, it gets in the way of their daily functioning. And of course, that's social functioning, that's work and everything else. So when you see a little bit of symptom relief, and that's the focus of any intervention per se, that itself shows progress. So you're right, it's not like a broken leg, but if you know better, you do better, and you do feel better. And that's always been the focus of any intervention, symptom reduction. So, but the next question is, how do we know the right method to get better, and when do you know when you've gotten better? I think objectives of reducing symptoms to the disorder are put in place in the beginning. So we talk about that with our patient. We go, okay, what are you anxious about? When are you anxious about? We're narrowing down the scenario, and that's put into place as part of the treatment intervention or the program that we start off. So everyone is in the know. But as a clinician, we are also, we know the quantitative and the qualitative way to measure symptom relief as well. It's not like we just observed that we have standardized measures that we use in our own clinical population, like we can use that similarly in Malaysia. It's adapted to our society, so we have measurements that patients can actually talk to us about, and we observe it as well, and they mark their answers, their rating scales. That's all very important information in reducing symptoms or observing progress. But most importantly, I think it's important when we hear people who they, like loved ones or family members or friends who accompany them sometimes during intervention, would also sort of validate their progress. Say, yes, we're not seeing him or her not so anxious anymore, not feeling a bit more better and a bit more relaxed when talking or walking out of the house or not confined to the house, or the mood's a bit better, she's coming out for shopping a little bit there and here. So that also is a very subjective and qualitative measure. I think that's the best way of saying it. So there are pretty much measurements at place, but these are some of the ways.
So the support system is very important for patients.
Oh, absolutely is. Absolutely, without a doubt.
You were a consultant clinical psychologist in a hospital in Penang. Tell us what you're doing now in New Zealand and the area that you're particularly passionate about.
I'm happy to do so. Well, I've been on an academic sabbatical since early 2018, and I'm pursuing a PhD in Massey University in Wellington. And I'm due to return home, though. I'm not staying here for...
I'll see you in Penang when I get back.
back to work sometime later this year. But what I am passionate about and always been is I've always been intrigued on how people cope, because generally people come with various disorders or anxieties or whatever issues they have, various means of it, children, adults, and older people. But the underlying question that I felt over time when I was at the hospitals in Penang in Malaysia is when people ask me, how am I going to get past this? How am I going to cope? So that was a bit of a theme that was going here on during my my stint as a clinical psychologist. So I thought, why not investigate and research different styles of coping styles and resilient levels that influences stress and general well-being. So I had the opportunity to meet up with another expert who is my supervisor right now, and I got on to writing a treatment manual, a psychological resilient treatment manual that is completed, but it's also being tested right now as we speak on participants. So my participants are mainly local and international tertiary students, and also people in the high risk occupation like the police and the firefighters. Because I find that if I really want to validate the treatment manual and show that this is effective, I need to show if it's workable for people of all ranges of stress levels, probably between mild, moderate, and not too severe, but that's what's being tested on as of now. So I'm hoping to get some results and probably publish the treatment manual sometime next year, perhaps. We'll see.
And that's something really apt, right? Coping and resilience. These are areas that are so apt right now in what we are going, like we as human beings going through this crisis at this time. Things are uncertain. People are anxious. You know, public health, the economic health at this moment is so uncertain. What are the different coping mechanisms that people can subscribe to in order to maintain and protect their mental health during this COVID-19 crisis? People are just talking about this more often these days.
Yeah, thank you for that. I'm glad that you asked that question. I want to answer you in a sort of like I want to make sure that I cover all the topics. I'm going to be looking at some of the notes here. But what's more important is the definition of what resilience is and what's coping is, right? So I want to get started with that. So psychological resilience is defined as a positive role of an individual differences in people and how they respond to stress and adversities. So how a positive role in an individual helps them cope with stress and adversities. Coping, on the other hand, consists of behavioral, cognitive, and emotional strategies, so that a resilient individual will use. So what I'm trying to say is, when an individual who is able to push a little bit more and they are using these strategies, they naturally cope better in any given situation, probably in a very dire situation. And unprecedented times like these, it's very important to be open to change and creating a new normal and creating routines. It's very important to do that. So those are the two definitions. But there are 4 areas I want to explain. I'll explain a little bit in length. The first is to recognize your own responsibility that help build a better set of behaviors. So if you're recognizing yourself, if you're venting a lot, if you're blaming, doing the blame game, self-blame and blaming other situation outside your control, you're practicing poor distractions like you're eating too much or overindulging with news, like constantly checking out how the coronavirus is doing over globally. All this can actually aggravate a situation. So instead, you could ask yourself, how can I change my behavior? How can I modify my behavior to make the most out of the day? How out of the current situation? Like, what am I doing here? Where am I at? And probably putting meaning and purpose to the activity. Like when you are cooking up something with your family and you probably haven't had a chance to cook up various dishes. I'm seeing a lot more of people on Facebook putting up their cooking MCO day 14, and there's lots more cooking going, and they're quite impressed with their cooking, so obviously that's why they're putting it up. So these all are skill making and meaningful purpose. I'm sure that when all this is died down and everyone's back in some level of normal or new normal routine, the children will obviously look back and say, I love the way, Mom, you baked me this, and I love the way the dad played with me this. And you are making an impact with children, with family. But if you're alone and you're just, probably isolating like me, I think probably because I'm far away from my family. So what's important is doing things that you didn't do before. I catch up on some nice blogs that make me laugh. Humor is always good. So my go-to is Carpool Karaoke with James Gordon.
I love those. Yes.
Yeah. It's something that I don't get to do because I'm often very busy. So I take a little bit of time off to do something that I like. So that's taking personal responsibility. The second area that I like to focus is self-care. That's very important during isolation. I think taking some time to exercise, even if you can do just some stretching or basic exercises, that's important. Making sure you have meals sometime, or even drinking water, enough water. That will be, something that you do for yourself, self-care. Taking the break from news or normal routine, creating a time or a space in your place, in your room, in your house, where you can just go to and do something different, knit, or even, sing, play your, probably musical instruments that you've never touched before, or write a song, whatever it is that you haven't had a chance to do. And obviously, most importantly, getting sufficient sleep. That's sleeping on time.
Right.
It's also very, very important.
Yes.
So that sort of routine making, acknowledging that you're doing the best that you can in such a dire situation and a new environment, it can be sort of like something that you can appreciate yourself with. And then the third one, as I said, it's going to be a bit lengthy, is social support. I think seeking social support during some sort of like times like this is very important. And social support, again and again in research, have come up as one of the main things that people need to do in order to reduce stress. So, and you need to understand social support is just not talking to family and friends alone, but also listening to probably health professionals on how you take care of yourself. And if they're asking you not to go out, don't go out. Listen to advice. And don't be shy with the governmental fundings if you can get access to it, and there's probably free food being done, and you don't feel and you feel like you are struggling. Please go and access that services. Don't be shy. Those are the social supports that we all need to help each other in any formal way. You also can give support to other people, sometimes talking to friends. So when you reciprocate that sort of social support, that's also very good. And I'll come to my final point, which is challenging irrational thought. I think that's very important. It's okay to tell yourself another story, sort of like reframing the current situation. Like, you're not alone in this, and we're all together. There's a common humanity in this aspect. So the pain is, everyone is feeling the pain in different levels, but we are not doing this all by ourselves. So when you feel alone, just remember that.
And that last point, is that the same as finding optimism in a very dire situation? Is that the case? And if so, would you think that, Miss Sarah, that there are people with different resilience level, people who are more optimistic and more resilient by nature?
I think, yeah, I do think that there are always options, like we can move on to, like, there's no doubt stress and stressful times create changes, as you put it, but there are generally 4 ways somebody can cope. So one is, some people will cope by just defeat, like, I can't do this anymore. And that's fine as well. There are people like that. And some people will survive with impairment, like, I can do this, but it's going to be so difficult. So there's a little bit of, probably difficult mindset that's causing them to, trot along, but with a little bit more burden, tied, shackled. But there's also people who achieve resilience, pushing through and maintaining certain level of progress where they can see progress, cooking and taking care of the family, or the husband doing what he can. So it's that sort of like compromise that happens. And to your surprise, you can actually thrive in these times too, because you progress well, better than expected. So that, even in this time, you'd be thinking, oh, I couldn't have done that in my mindset before, but given 30 days or 35 days in lockdown, I can actually do this. This is
right. We got through this.
Yeah, we got through this. So by applying those coping strategies that we talked about just now, it's quite important that you can do that and then try to get on with the daily. So yeah, people do cope in a different levels. Yeah.
Do you believe that adversity, what we're enduring right now, for example, builds character or reveals it? And during this time, are there different coping mechanisms? I know that you talked about the 4 different steps here, but are there different coping mechanisms that people who are already living with mental health conditions should subscribe to, as opposed to people who have never suffered from any mental health condition in the past?
Okay, so like we said, that 4 ways of, the defeat, the surviving, through impairment and all that. But I think it is when you apply the suitable coping strategies, again, both groups will do better. I think both with people with mental health conditions and people, they will. But in addition to that, I must add that people living with mental health conditions are advised to contact their doctors, to contact their clinicians, to keep up with, if they're feeling overwhelmed, talking to them by phone, and to be open to e-therapy, e-intervention. A lot of patients may not be familiar with it, uncomfortable with it, but slowly easing into it is important. Making sure they have their refills of medication if they are on medication. All these are important, practical things that you need to do in addition to the self-care and social support and, all the other strategies we spoke about just now.
Right. You mentioned about your journey in clinical psychology. I believe, and I've heard from people as well as I heard from you in the past, it is a long journey. What would your advice be to young talent who aspire to pursue psychology? I realize that there are many psychology graduates out there who don't necessarily choose psychology as a career path, and I've always wondered why. Yeah, could you share with us why, and what would your advice be to talent who want to pursue this career path?
Okay, I'll answer the latter part of your question first. I think it's important how you advise them is to make sure that they go into a program, they're signing up to a program well informed. Make sure that they get all the information, like from year 1 to year 4, 4th year, what are your subjects that they're going to cover, is it really psychology focused, or is it maybe it's got different things? Sometimes they have business psychology, they have social psychology, they have different things.
Yeah.
So what are you really interested in? As of course, they will start off with introduction to psychology and move forward with that. But it's important to see the third year, the fourth year, what are the programs? How is it, how is it modified, or how is it structured? Is that something that you are interested in? The next thing, very important thing, is not to assume that one becomes a psychologist just by completing their 4 years psychology degree. That is not that. What you are at the end of that 4 years is a student of psychology, a psychology graduate. You're not a psychologist by any nature. You may know the art of psychology, you know the science behind it and the research behind it, but taking it a notch further is the important thing. So if one person wants to end up being a psychologist, they then need to move into a 3-year master's level program, perhaps in a clinical psychology or forensic psychology or neuropsychology, whichever it is, that makes them a psychologist of that nature. So you don't end up being a psychologist. So most of students come in with that sort of whimsical attitude and a wishful thinking, rather, thinking that I am a psychologist. No, you are a graduate, and it's important to use that time to learn more about the subject matter and what is there out there for psychologists. And so these are very important things. It's very nice to see and very encouraging to see more people into psychology. But not everybody ends up being a psychologist because they don't move on to do their masters and their PhDs or their postdoctorals after that. So they don't end up being, there's no career path, and then they end up being probably going to human resources or something else, or even stopping career altogether.
For people that wish to pursue it and have that longevity just like you've had in your career, where do you think they should start? I see a lot of psychology grads from my conversations with them. A lot of them work in non-governmental organizations, NGOs. But where do you think they should start? Should they intern at a clinic or a private practice perhaps?
Okay, they can do that by volunteering in local NGOs, like you said, and also volunteering in soup kitchens are quite interesting as well.
Yeah.
Working with social work will be beneficial. Anything that you can get hands on, maybe tele or e-psychology on the phone, telephone psychology or telephone counseling, something like that can help. But I need to reiterate that only master's level clinical students, at least in Malaysia, are often granted permission to intern in hospitals because they're trained how to get to work with patients, because we are working with vulnerable populations, so we don't want to subject them to somebody who may not understand the full length of the disorder. So it's very important to make sure that you have the right qualification, because when you intern in specific hospitals or private clinics, but naturally people can go to NGOs if they want to have a flavor or understanding. Just there are a lot of NGOs who's looking for part-time students, so that can be an initial stage interest that they can do.
Do you think we are facing a lack of clinical psychologists or well-trained clinical psychologists at the moment in Malaysia?
I do think so. I think we do need. I think if you look at the percentages in the first world country versus ours, there's a huge lag. So I'm not sure of the numbers per se, but I think it'll be encouraging to have more universities, valued or local universities, opening up proper programs that can then again fund for specifically for clinical psychologists. But you must know, like I said, it's a very competitive program. So at least when I was training, there were only about 10 to 12 people that usually get admission into the program.
Wow.
So it's quite, so a lot. They get a lot of applications, and applicants are interested to come on board with a very good GPA from their psychology, bachelor's in psychology, but still don't get in because they do need sort of like a balance, like you said, an internship experience or a work experience in addition to grade and as a good student, So you need to be a good student. You need to be also a person who's actually done a little bit of work, and then you can apply. And that's also hard to get in. So you have to keep up that spirit and reapply it. And if you're really passionate about something, you don't stop.
Right. What are the important traits that you think somebody should have in order to have a long and successful career in psychology? Is empathy one of the traits that you would recommend for people to have? I'm sure there is an innate trait that they should have, but I've also believed, and I'm not sure, you might want to correct me on this, that you have to have that certain resilience, strength in character, in order to go through, number one, the whole course of psychology, but also to have that relationship with your patients, and having that empathy, objectivity, at the same time, that detachment at the right level. But what do you think are the traits that you think they should have?
I think instead of traits, which is quite static and inherited, I think the adaptability, the sort of like work ethics, working through difficult challenges, putting yourself in a situation where you need to be able to be subject to criticism or even opinions, and how you push through that is important. So just, it's not the trait, but it's actually a developed character or behavior skills that you can now know this is where you're lacking, so you need to, if you're interested in something, you want to know more. So there's a little bit of humility thrown in there. There's a lot of empathy in all these things, and other skills will be again thought and reiterated throughout the clinical training. As I said, clinical training, a good one, is really important, but a natural inquisitive mind can help. A person who's always interested to an ability to solve problems, like how do we get to the end of that, and want to find novel solutions as well. How how can I get past this? How can I help people? And not be afraid of hard work, and not be afraid of doing a little bit extra. Doing proper research is also important. I can't emphasize enough how Malaysian clinical psychologists should be encouraged to do more research, and I'm sure they're all very busy doing what they can do, but there will be a time, hopefully, a sect of clinical psychologists will be interested in pushing forward in what's new out there and getting the best treatment options out there, or anything evidence-based practice is so important, and research does that for you. So obviously, if we have more clinical psychologists, then there will be time for some senior clinical psychologists or someone around the midstream of qualifications of professional to step back and do a little bit more research to enhance the service. So you would need someone who doesn't shy away from hard work, and also to continue studying, even though when you are well respected, there's always an avenue to progress and do and make more of your skills. And so never be shy of doing better, and age is not a number, as we put it, so you just push through, because skills are supposed to be enhanced. You'll see the best doctors are the older ones, because they're quite well versed, they've seen quite a bit, and they're also indulging with research and keeping in touch with what's new out there. So if a person can do all of this, then probably they will have a very successful career.
And that discipline, right, to get through the whole thing, and the whole course and study. All right. Yeah. I am so excited about what you are doing, having your research in coping and resilience. I would definitely want to talk to you more about that. When I see you in Penang, and when you get back to Penang, when is that going to be? End of the year?
Hopefully by the end of September, but we'll see how it goes.
Yeah.
But hopefully, yes.
All right. So anything else you would like to add, Miss Sarah, as we're wrapping up this conversation?
I think that read more. I guess for everyone, sort of like be aware that mental health is important for everyone. It's not subjected to people who struggle, and mental health and having ability to cope through things is for everyone. So it's not about when you are in a stressful mode. It's just understanding, observing how you respond to situations, circumstances are all important. So not to sort of box it into someone who has mental health issues. That's only can get services. You can actually get services and talk about anything with anything.
All right. Thank you so much, Miss Sarah.
Welcome.
Thank you for sharing your insights and allowing us to really pick your brain on this very very apt topic during this time. We are going through such a difficult, such an odd time. Most of us are also going through this for the very first time. So thank you again, and take care of yourself. Everyone, that was Miss Sarah, our latest guest for our latest episode of Why People Do What They Do. And this is our second FB live stream, so I hope that you guys are enjoying it as much as we are putting it out there for you. If you haven't yet, please like and subscribe. Our show is on YouTube, and you can also find us on Spotify, and you can go to www.wpdwtd.com for more of the content that we're putting out there. Miss Sarah, thank you so much. I hope to catch up with you end of the year. I'm sure that time will fly by and we will see each other very soon. So thank you so much.
Thank you again.
Yeah. Thank you. Stay safe and stay healthy.
Will do. You too.
Thank you. Bye.